Hi, my name is Franklin Muche. I want to say a quick shout out to Professor Chu and Dr. Wen for helping me with this research. I'm here to talk about staffing optimization in a hospital. So we wanted to investigate the staff resource allocation in critical care units and inpatient units at a hospital, and we wanted to have them achieve maximum workflow efficiency. So one thing we did is we tried to create the best schedule for a hospital based on the amount of patients they see daily. So this is based on a 5/8 schedule, which is nurses working 5 days a week for 8 hours. So we tried to find the minimum number of nurses needed each day. And then we made our own schedule to see if we could improve from the hospital's current schedule. So first of all, we look at the patient census to see how many patients were at a given time or a given day. So the departments we looked at were the ICU, the 3 West and 5 West at the hospital. So we broke up the two shifts in the hospital, the morning and night. And then one thing that was very important is the nurse to patient ratio. In the ICU, it was 1:2. And then in both the 3W and 5W departments, it was 1 to 5.5. Using these numbers, we were able to convert the number of patients into the number of nurses needed. Other things important in this presentation is that there's also one super nurse that's added, but does not actually affect with the patients. And there's also sometimes patients need extra help, so they have a one-to-one care, which increases the amount of nurses needed at a given time. So we also had to calculate the supply of nurses. So for that, we added up all the nurses we had, and then we added half nurses and part-time nurses accordingly. And then we converted that to the number of shifts were available each week. And we multiplied by 3 to get the shifts, because currently the hospital is working at a 3/12 schedule. So nurses are working 3 days of work a week, 12-hour shifts. So in the ICU, we saw a very dramatic difference in the average demand of nurses and the number of nurses currently on hand. We saw that there's a huge deficiency of nurses, and that needs to be an increase of nurses in this department. From that, we built our own average schedule, and we saw that our average schedule, we would need to increase the amount of FTE, and it would increase the cost of the hospital at that given time. But now the hospital will be running much smoother and will be able to meet their demand. Now, we also saw something similar in the 3 West, where we saw currently they're very much under their average. Quickly, I want to explain these percent fills. So we took their budget, and 100% fill just means their current budget or how many nurses they want. And we see if that matched up. We can see in the daytime that their budget is way over the maximum amount of nurses they need. So from that, we understood that they need to decrease their budget, but still increase the current amount of nurses they have. We saw that also in the night shift, we saw they had an adequate budget, but still need to increase the amount of nurses at the hospital. Also, we looked at 5W, where we see in the daytime shift, there's a deficiency of nurses currently, but in the nighttime shift, we have a very level amount of nurses. You can see this reflect in the cost and the FTE values, as we currently need to increase the number of nurses, which means we have to pay more, but now we're moving at a higher efficiency. And if we compare schedules with similar efficiency to the optimum schedule we made, we see that we will actually be saving money. So the premise of this research was to look and see if we could save money, but also we want to make sure the hospital is running at maximum efficiency at all times. This can be translated to every department at a hospital. Simply, all we would need is a patient census, a staff census, and then simply the amount of workers to customer ratio. Thank you for your time. My name is Franklin Muche.